Hey, welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about an important part of chronic pain management, and that is the chronic pain person's family and friends. Often, not only is the person suffering who's living with chronic pain, but their family and friends end up suffering too. Many times it's because they just don't know what to do. Sometimes it's because they just cannot understand what this person is going through. Often they get burned out, they get frustrated, and a lot of them become hopeless and helpless. Some form some type of mental health problem like depression, and it is real challenging. If you're watching this on YouTube, please go to the link below and check out our Freedom from Suffering Now blog where I go more in depth. I talk about this a lot in my book, Freedom from Suffering, A Journey of Hope, the 7 strategic steps to effective chronic pain management. And at the end of the blog, you'll also see a link to an article that's free, and it's on our website, freedomfromsufferingnow.com. And it's the role of family and friends in chronic pain management. It is an important one. You know, if you have not lived with chronic pain, imagine for a minute. Think back to a time when you had a really severe acute pain. You broke a bone, you got cut, you got your thumb smashed in a door or hit yourself with a hammer. For some of you women out there, you went through childbirth. Now, get that picture, get that emotional picture, and try to remember what that felt like, that intense acute pain. And then if you can, imagine what that would be like if you had to live with that 24/7 for 6 months or more. Because that's exactly what's happening with a lot of the people. For a lot of people, they're on medication that in the short term may help that, but in the long term, it may end up causing problems. And the more common problem is their system becomes hypersensitive to pain signals because of the opiate pain medication. Technically, this is called opioid-induced hyperalgesic effect. But there's other problems too with some of this acute pain medication that's used for chronic pain problems. People may get constipation, they may get overly drowsy, they may experience mental confusion. It's about quality of life. Quality of life goes down for a lot of people unless they get appropriate help. And family and friends need their own help. They need to have support. They can go into some severe burnout if they don't. So I want to encourage people, if you know someone, a family member or friend who is suffering with their chronic pain, please check our blog out, check my article out, check my book out, and more importantly, let your family member or friend know that there is hope. Freedom from suffering, I believe, is everyone's right, and it's also their responsibility. I'm not just talking about this professionally because I have lived through this, and I know what my partner Ellen has gone through when I have pain flare-ups. I feel guilty and ashamed because I have to stop and take care of myself and leave her covering things sometimes. I know how frustrating it can be for her. And I know more importantly how debilitating it can be for me, especially in my first 2 years of my process of recovery from my severe injury. I was hopeless and helpless. I didn't want anybody around me. Fortunately, people who cared about me didn't care and they came around anyway. Please, there is hope. There is help. Take action. Thank you, and please check back frequently.